Good morning, Richard Eckley here. Happy Monday morning to you. We're on a Monday, so on a Health Monday on your 4 keys to a healthier, happier you. And the question is, where do you get advice from? We all know if we have a toothache, you go to the dentist. And if you have like a illness, you go to the doctor. But the problem the system is we've been using for hundreds of years now is we wait for a problem to come, either the toothache or an illness or a pain, and then we go to the doctor. So we're actually practicing symptom first of all, and then try and cure that symptom. What we need to start doing is actually practicing preventative care. So looking after our own bodies, so we actually prevent ourselves from getting the illness and the disease. As we said before, 10% of illness is genetic. We get that from our ancestors through our DNA. It passes down to us. It's something we really haven't got that much control over. But 90% is down to how we're choosing to live. So these pains and aches we're getting is often down to how we're choosing to live, the lifestyles we're choosing to live. So if we start to practice preventative care, preventive medicine, we actually look after our bodies. We give our bodies what they need, the food it needs, the good ingredients it needs, the exercise it needs to be a healthy body. Naturally, our bodies are naturally healthy. As I said before, if we were born healthy with good genetics, we can have a natural body, no aches or pains, and have a good healthy body. But it's only how we choose to live our lives that we start to actually, perhaps we're sitting down too much, we give ourselves backaches. Perhaps we're not walking too much again. Perhaps we're not eating the right foods, we're putting extra weight, so we're having heart problems because we're not getting the right ingredients into our systems. So it's actually deciding, first of all, I need to start taking preventative medicine, looking after my own self. It's not a tablet. It's what I'm eating. It's what I'm drinking. It's what I'm choosing to do. It's what exercise I'm choosing to do. So I'm actually looking after my own body myself, not relying on a doctor, not waiting for a symptom to come up and then think, oh God, now I've got a pain. How can I help with it? If you start to do stretches, if you start to do meditation, if you start to do eating properly, going for walks, you actually prevent all these things from happening. So it's preventative medicine. So who can you get advice from? So you want to get advice from someone who's had long-term life, long-term health experience. If you've got toothache, you go to a dentist. If you go to a doctor, to get the symptoms sorted out, you go to that. So you need to find a practitioner who's actually got a good system going there, keeping healthy. They're not aching, they're not in pain. They're being in it long-term, so they know what they're talking about, and they can help you and advise you on the best things you can do for yourself. And the basics are very simple, because it's literally eating healthy, exercising healthy, getting your sleep, getting your water in there, and not stressing so much. So those are simple basics you need to do. And then you start to take care called preventative medicine, which is actually you preventing yourself having problems in the future. You're preventing you getting your heart disease, you're preventing getting cancers, you're preventing having problems. As I said, there's the 10% which is genetic, which unfortunately is beyond our control. But when 90% is in our control, it means we can start to take preventative care of our own selves by getting the habits we need to have, getting advice from someone who's doing the things we want to have, has the health we'd like to have. We get advice from them, and then we can follow the path they have, and we can make ourselves more healthy and have less problems in the future. And if you're getting less problems in the future, you're cutting down on hospital medicine rate, on hospital waiting lists. You're cutting down on seeing your doctor. You're cutting down on all these other services, which people who aren't taking preventative medicine are going to be using more of, because they're just going to keep waiting until they get a problem and then have to wait a couple of days or weeks even nowadays to see a doctor. But if you're actually doing the exercise you need to do, you're eating the food you need to eat, you're drinking the water you need to drink, you're not going to have the problems in the future. And so you're actually helping the system as well. So it's all good. There we go. Have yourself a good one. All the best for now.